My name is Jessica Fishburn and I'm one of the directors and a pelvic floor physio here at Genhealth Hamilton. At Genhealth we provide physiotherapy, podiatry, occupational therapy, exercise science and group classes in clinical reformer therapy or clinical Pilates to our region of Hamilton. Hamilton has around 10,000 population within the centre of it. However, we've got a pretty big outreach within 100 kilometres of the clinic. And so we're servicing populations like the rural community, agriculture and local industry as well.
My name is Joyce and I'm a podiatrist at Genhealth Hamilton and one of the directors. Genhealth was established in 2015. We have private paying patients who might just come straight off the street or might be recommended by a friend or family member to come and see us. We then also have compensable clients who are referred by either the GP or they might be on some sort of government funded thing like the NDIS, TAC, WorkCover or home care packages. And they are generally the types of patients that we see here, and they're the people that get access to the service that we provide here.
As a pelvic floor physio, I have lots of women presenting to see me for a number of reasons, but particularly because there's not many pelvic floor physios in our region. So I do lots of antenatal and postnatal care. I see women presenting with pelvic pain and prolapse. My biggest interest area is pelvic pain. So I do get referrals from our gynaes and gynecologists from about 200 kilometres away. I do lots of telehealth with these patients as well. So patients will be travelling quite substantial distances for an initial consult and do follow up with them via telehealth. I do lots of education sessions with our local community and that does promote a lot of referrals as well. I get some self-referring and I get some referrals from GPs. Genhealth, being the combined allied health clinic, provides a really unique opportunity for patients to get all of their care in the one location, and our clinic mission is together strengthening the health of our local community. So it's really actually about that collaborative community approach. A patient can come in, see the physio, see the podiatrist, do their Pilates and also get their footwear sorted in the one-stop shop rather than having to go to different regions or go to different towns to be able to access all of those services. We're able to really optimise patient outcomes by ensuring the best latest evidence is put forward to the patient and that they're able to access, which is not a common thing in rural and regional Australia. Really big key priority areas are very much having the ability to refer out to other health industries, particularly specialist areas like gynecologists, musculoskeletal specialists, orthopaedic surgeons. We're in an area where it is incredibly hard to get an appointment with a GP, and if that's the limiting, if an 8-week wait to get an appointment with a GP is the limiting factor to get a referral to the gynecologist, when I've got open communication with the gynaes, the local gynaes that I'm working with, that's something that's really important. Also just funding for research in definitely the women's health sphere, but rural women's health and what actually is impacting rural women as opposed to our metropolitan counterparts.
We have quite a large team spread out over a few different disciplines, so that then means that if I've got someone here as a podiatrist that needs to be seen by a physio, I can send them across the corridor to be seen. Or same with exercise science, or whether that's an occupational therapist. So in this area, I don't know of too many more clinics that are this size with as big and diverse multidisciplinary team. The other great thing is that we have quite a young team here, experienced enough with the right amount of nurturing and mentoring, but young enough to bring a certain type of energy that you might not get at other clinics. Our eldest practitioner is 37 and our youngest practitioner I think is 23 or 24. So quite a young dynamic team, and I think that brings a certain level of energy which then transpires into a delivery of healthcare that I think is quite upbeat and fun and engaging.
With Genhealth, we had a vision of what allied healthcare could be like in our community. We didn't have business backing or business acumen, but we had a vision, we took a risk, and it has paid off, and it's been a very good financial and community-based business. I encourage anyone to have a go. You can always reach out and get financial or business coaches, but if you've got a vision, it's doable. It's really doable. We started as 4 young females, and we've now got a very big successful business, and we service approximately 9,000 of the 10,000 population in our community.